this is Penny, and we all know her, and we all know Lucy. She's the face of ValuePetSupplies.com as well as Big Lug. And Penny's on a few of our shots also. So we're here today. I'm going to be bending down so people can get a better shot of Penny. Come here, baby girl. Penny's a nose hound. She loves smelling everything. So we're going to be going inside. It's good to build a great rapport with the vet in your area, rather than when you just initially bringing your dog to the vet and having it go through its annual inoculations and checkup. Just make a trip when you first get a dog. Just take a trip to your vet. Build a good rapport with the staff. Have the staff give the dog some treats, and then leave again. And do that a few times during the course of a couple of weeks, a couple of months before you do initially bring your dog in. That way your dog is less stressful, not coming to a strange place. It's more familiar with the people that work here and more familiar with the surroundings. So it's very important to get your dog checked annually. Heartworm, highly important here in the state of Florida. Distemper, rabies shots, a good pet owner, due diligence, make sure they're all current on their shots. If being a hurricane state, if you had to evacuate your home and you had to go to a shelter, they will not accept your dog unless it is current on its inoculations. So something you must keep records on and have done on a regular basis. So continue to watch, follow us inside TLC, and see how these guys make out.
Hi, I'm Dr. Debbie Moore of TLC Animal Hospital. I'm the owner and the full-time veterinarian here. Today we have Penny and Lucy, and we will be doing their annual exams. And Lucy is due for her heartworm exam this time. Penny just had hers a couple of weeks ago. And we're just going to check them out, make sure everything's healthy, and give them a couple of vaccines that they're due for, and just answer any of the questions that the owners might have. Did you have any things that you wanted to address specifically?
No, the heartworm is like the major thing. And you recommend every 6 months as to a year for a dog to come in to get a checkup here, or? Like
I said, it's age. I think that, we just had a dog that was adopted by a rescue group locally.
Yes.
That the dog was, I think he's 12 or 13, and the owner was elderly and could no longer take care of him, and he went and was adopted out, and the new vet that had examined him found a heart murmur, and then he did develop a cough shortly thereafter. And the problem was that, we had seen this dog 3 or 4 months prior for something totally, he's bit by a dog, whatever, and this dog was fine. And then here he is 3 months later, December, January, and he's got a heart murmur, and he's got a cough. And so being an older pet, things change rapidly. So yeah, I would say 7, 8 years old, you got to start thinking about bringing them in more often.
I see. So after a certain age, once they start getting older, it's always highly recommended you do get them in there as 6 months, a 6 month span at each time, because things can change more rapidly, like Doc was saying.
So about seven years or so is a good time to start considering twice-a-year examinations.
Okay.
So
there you go.
Yeah.
One of the current concerns here in the state of Florida, mosquitoes, and it's always a warm climate. Heartworm is very, very detrimental to the dogs down here, and it is contracted through mosquitoes. It is a fallacy about people, they say they don't bring their dogs outside.
Right.
So do they have to worry at that point? Do people have to worry about getting their dogs on HeartGuard or any kind of a heartworm medication and getting them checked as well? Is that something, even though the dog doesn't go out, or cat?
Yeah, they come inside too. So even an indoor pet that's on like little pee pads or a box, litter box, they can get heartworms too, or they take the dog to the groomer. It is,
it's going to be outside at one point, going from the house to the vehicle. I've gotten bitten inside our own house.
Absolutely, and it's the thing is it's Florida. It's they're everywhere, and it has nothing to do with cleanliness. How good you groom your dog. Even chows with a big thick coat, yeah, they're at less risk, but the nose, the ears, mosquitoes do burrow. So thinner coated dogs are higher risk actually, but regardless, it's just not worth it. The treatment is expensive. There's risks to the treatment, to the dog obviously. So we always want to prevent it as opposed to waiting for it to happen. It's like basically playing roulette.
Yes.
Some people test it every year and say, well, he was just tested, he's negative. You can be negative one month and they can be positive the next.
It's like a person. You could be healthy one minute, the next day you can come up with a flu virus.
Absolutely, absolutely. Or meningitis. I mean, that's a mosquito-based disease that people get. And so the thing is it's so easy to prevent, and it's so inexpensive to prevent. It is actually cheaper to prevent heartworms than it is to prevent fleas.
I see.
And the thing is people don't see heartworms, so they don't think it's a big deal. But you see fleas and you say, oh my God, look at these fleas, I gotta get rid of them.
Exactly, out of sight, out of mind.
Exactly, the heartworms are scarier because they can cause death.
What else can come of fleas if a dog does have fleas and they start biting at them and they ingest the fleas? That can cause a parasite, correct?
Absolutely. There's the tapeworm. A lot of people are familiar with that. It's a little white parasite. It's about yay big. Looks like a flattened kind of rice. Yeah, a grain of rice. Sometimes you'll see them all connected together in a strand, so there'll be a bunch of little segments connected. So that's a little kind of freaky when they're that long or whatever. But if it's that, you know, rice thingy, that's a tapeworm. They get that from ingesting fleas. The best prevention is having them on flea prevention, flea products.
People look at me like I'm very weird, but every time my dog does go outside and defecate, I watch and I check their stool. You know, and if I have to pick up a little stick, I'll go through it just to make sure there's no parasites in there.
Yep.
And even that is not 100% because a lot of times a lot of parasites are not visible to the eye. They're microscopic.
Exactly. Yes. The tapeworm is visible if it does come out on the stool. Or on a lot of cat owners, the cat will be on their lap and the cat will get up and you're like, what is on my lap?
I see. Yes.
Yeah, so that's sometimes how you know, because cats a lot of times bury their poop, you're not going to be seeing anything, so sometimes it's the lap issue and you're like, ugh. Florida is like a soup of parasites.
Yes.
I mean, it's just, so we don't get that kill off like other northern states do, but so your pet's walking outside, licks his feet, whatever, they can get these parasites. So, but a lot of those are prevented by your heartworm medication, or at least controlled. It's not 100%, but it's like 99, 98% effective against your hooks, rounds, whips. Your hookworms and roundworms are things that are contagious to us. I mean, they can do some nasty things to people. Children, they got their hands in their mouth.
That's right.
Being barefoot outside.
Yes.
It's not the greatest thing in Florida because, again, the ground supports parasites. These parasites actually can migrate through our skin and get in our system and cause eye damage, skin damage.
Cats to go out in sandboxes that children have out in their backyards and they'll play in this and they'll litter in the sandbox.
Yes.
Children will go out there and there's many, many diseases that you can contract from your pet. We're going to take a break. Continue to watch. We got many, many good. This is just a few of the reasons why you need to see your vet on a regular basis. We're going to come back and we're going to talk about spaying and neutering and what type of diseases you can contract from your pet. Stay with us. Don't go nowhere. Thank you.
This is Rafael with Casita Big Dog Rescue, and this is my rescued American Bulldog, Big Lug. Thanks to our sponsor, ValuePetSupplies.com, Lug and I are able to save dogs at our shelter. Every purchase you make at ValuePetSupplies.com helps in saving these beautiful dogs from being destroyed. Follow us on Casita Big Dog Rescue YouTube channel. Buy from our sponsor, ValuePetSupplies.com, and you could be part of saving these majestic animals. Save a life, adopt a rescued pet. Right, Big Lug? Hi, this is Rafael Cabrera, leader of the pack. Casita Big Dog Rescue, sponsored by ValuePetSupplies.com. We're at our local shelter. As you can see, all these poor dogs here in desperate need of salvation. They all need to be helped. They're all great dogs. They're all here due to behavior problems. These are dogs that truly need to be saved. As you can see, there's too many dogs, not enough people. If you want to make a difference and you want to help, you can contact me at Ralph@CasitaBigDogRescue.com. I will help meet with you here at Citrus County Animal Services, and I'll help you find the right dog to fit the right family. Look at these guys. How could you resist? Look at these poor faces. Help me help them. Contact me again, Ralph@CasitaBigDogRescue.com. Come down, save a life. Thank you.
Welcome back to Casita Big Dog Rescue. Of course, we're over here with Dr. Debra Moore, DVM at TLC in Inverness, Florida. And with us also is Tara. She's Doc's vet assistant. She's going to be helping her with Lucy doing heartworm and doing many other procedures, giving her inoculations and everything. And Doc will be giving her pretty much a blow-by-blow, letting us know what she's doing and the reason she's doing it for. And we do want to thank Tara. Tara also saved the dog from the shelter, Cover Girl. She's had it now almost 2 years, and turned out to be a wonderful little girl. I got to meet her a few times, and we want to thank Tara for that. Thank you for saving her life. So, as we watch Doc and Tara do their magic over here.
So what we're going to do actually is peel all this.
Yes, ma'am. Thank you.
Tara, will you pick her up and put her back down so we get an accurate weight? Because she's kind of wiggly when we first put her on the scale, so we're going to try to get an accurate weight. Some are wiggly, but we do our best. Stay loose. 18.6. 18.6. Okay. So it looks like Lucy's gained a little weight from last year.
Yes.
So, but she's up and down. She's been 18.8, 17.8. Now she's back at 18.6. So we'll check her out and we'll see what her body looks like and see if maybe that's a good weight or maybe it's not. So we'll check her out.
Very good.
Hi, honey. So usually we try to greet them and make nice with them. We don't want to scare them, and we look inside their ears. If I see any debris, redness, an odor, sometimes we can smell an odor, the owner complains of an odor, we'll go ahead and dig a little deeper. If the owner complains of any type of hearing loss, we'll take a look. It looks like Lucy's eyes are a little bit pink, but she's kind of excited, so sometimes their eyes are a little bit redder when they come into the vet.
Yes.
So you haven't...
normal for her.
It's for her? Okay,
yes.
Yeah. As long as you don't notice any squinting.
No.
Squinting is an indication of pain that needs immediate attention from a veterinarian. So then we always take a look at their mouth. If they're nice, we use our fingers. If they're not nice, I might use, or they're nervous, I might use some like Q-tips, those long Q-tips we have, yes, or some tongue depressors, and we'll look there because we do want to get a look, at those teeth. And actually, Lucy has really nice teeth. She's got minimal tartar, missing a couple, but that's okay.
Yes.
And come here, baby. The gums are a nice pink color. This is what we want to look for if your pet's ever having breathing issues, or basically they always should have nice pink gums. Now some of them do have pigment or freckling of the gums.
Yes.
But as long as you've got this nice pink color, this, if you push on it and let go, that's called the capillary refill time. It should take a second. So 1/1000. I mean, that was less than a second. That tells her blood's flowing good, oxygenating well. Let me see, Liz. So I just usually feel around. They have different lymph nodes in different areas, under the armpits, under the groin, sometimes back here in the thighs there's some lymph nodes. Lymph nodes, usually they can be detected if you're a professional. Some lay people can't do that, but if they are enlarged, that is a problem and they need to be seen by the vet.
Of course.
Okay, Lou, hold on. Okay, so we're just gonna take a listen to her heart rate and okay, so I don't hear any heart murmur or anything for Lucy, which is good. She's now about, looks like maybe about 9-ish.
Yes.
So her heart rate was normal. She's borderline. She's just a hair overweight. So I think maybe when she was back, when she was like 17-ish, she was probably, right, because we said she was 18 today.
Yes.
So 17 might have been the better weight for her.
Okay.
So, you're talking about a pound, pound and a half. We're not talking much, but on a small dog, that's, what, 8%, I don't know, 10% of their weight. Right. So that it adds up.
So it does make a difference.
Yeah, that's
smaller
like...
the dog,
it's like 10 pounds on a human.
Exactly. So it's all relative.
Mm-hmm. So then we go and we systemically, we actually, like I said, go from front to back is usually the best way for us to remember what to do. But feel the abdomen. Some of the dogs don't let us, or cats let us feel them because they're very tense. But Lucy's really, even though she's kind of antsy, she's actually letting me feel around. Sometimes we can, appreciate if the kidneys are too small or too big, if the spleen is too big, the liver's too big. Tumors, whatever, that's what we're feeling for. Bladder, not bladder cancer, bladder stones. Right. Some animals get bladder stones. Sometimes we can feel that, but usually owners will tell us there's an issue because they're having accidents in the house or seeing some blood in the urine, but sometimes we can actually feel problems, like I said, you know, that owners can't tell. And that's why you want to bring them in and not just rely on your own senses that you have a healthy pet just by the way it's eating and acting.
Okay.
I usually will do the lepto over here. And usually it doesn't hurt the pet. I know some people are like, oh, I hate shots, but the shots that we give animals go under the skin. They don't go in the muscle,
Right.
unless it's medication or something. But the vaccines usually go under the skin, and there's just not a lot of pain associated with that.
And that's called subcutaneous?
Subcutaneous,
Yeah.
Yeah.
Okay.
So go ahead and let's see, this is her influenza. So I'll usually do that one over the left hip. So they tend to be a little bit more comfortable here than back here, but Lucy's a trooper, so she didn't even budge.
She's been a very good girl.
She's being very good. So I think I'm going to do the heartworm next. So we just basically take a small amount of blood.
In one of our prior shows that we filmed from the shelter, we had the privilege of watching Jeremy, one of the kennel techs there,
Yes.
perform one of the heartworm tests, and it was very informative. And
Cool.
And it's always better to see a doctor do it.
So the last thing that Lucy needs is her bordetella, and so we like to use the intranasal. It's a once a year. There is an injectable form as well. They actually do provide different immunity, but this one doesn't have a needle, and most of them tolerate it. The ones that don't tolerate it, we'll give them the injectable. We just drip it in, and sometimes we get a fight, and Lucy's just a trooper. She's awesome, yeah. She's really good and compliant.
Yes.
So, and then I get sneezed on.
You get a little bit yourself there.
Yeah, so I get vaccinated every time, so I never get kennel cough. But, so yeah. So we're done with Lucy, and I guess we'll move on to Penny.
Okay.
Poor Lucy.
This is Rafael with Casita Big Dog Rescue, and this is my rescued American Bulldog, Big Lug. Thanks to our sponsor, ValuePetSupplies.com, Lug and I are able to save dogs at our shelter. Every purchase you make at ValuePetSupplies.com helps in saving these beautiful dogs from being destroyed. Follow us on Casita Big Dog Rescue YouTube channel. Buy from our sponsor, ValuePetSupplies.com, and you could be part of saving these majestic animals. Save a life, adopt a rescued pet. Right, Big Lug? Valuable bully sticks. This is one of the fine products you can find on ValuePetSupplies.com. As you can see, Wolf loves them. Healthy, natural dog chew treats made of free-range beef, chemical-free, healthy, safe, great for teeth and gums. Valuable bully sticks. They do come in different shapes and sizes. Order as much as you want or as little as you want. So one of the fine products you can find on ValuePetSupplies.com. Go to our sponsor, help them help us. Thank you very much. Valuable bully sticks.
Casita Big Dog Rescue. We're going to be looking at Penny now again. Dr. Moore, of course, is going to be taking care of her and doing all the diligent work.
Yeah, so again, we start at the head and examine the ears, and I personally don't usually use an otoscope unless there's I see something or the owner complains of something, shaking the head. You can get a good look in there, and owners can do the same, obviously. Look in there. You don't want brown, nasty stuff, yellow, waxy, heavy stuff. Their wax should be a very light color, and it's almost non-existent or invisible. So if you see anything in there, yeah, get it checked out.
Okay.
Yeah, she's got some good pearly whites. She's just getting a little tardy. You can see this brown stuff forming over here. Let's see how this side looks. Well, we're actually missing this tooth, but I think Penny had trauma years ago.
Yes.
Nobody knows her trauma.
We don't know exactly what happened. I mean, that whole side of her body's been traumatized.
She's got a crooked tooth. She's missing a canine, a couple of canines here. Yeah. But yeah, tartar-wise, she's looking pretty darn good.
Yes.
You'll want to watch this one over here. It's a little crooked, and the root's showing a little, so the tartar is wanting to form on that root. On that ridge. Okay. But it's not loose at all. There's not really any irritation. So, and it's just an incisor. It shouldn't cause any major problems with like chewing or anything like that. So, but yeah, dental health is really important. A lot of people don't think about it. Sometimes they need their teeth cleaned, just like people.
Heartworm's negative.
Okay, so Lucy's negative on her heartworm and her tick screening, so that's awesome news.
So that's wonderful news,
yeah.
right?
See how she's doing. And you know, Penny sounds fine.
Of course, we've spoke about Penny. She's only has use of 3 of her appendages. People wanting to adopt a dog with three legs, or a cat, or any animal, is there any different? I mean, besides the physical difference, you know, the visual difference. There's nothing wrong. I mean,
no,
Penny's
absolutely.
just fine the way she is.
Exactly. Yeah, I have a one-eyed dog at home, and you know, he's a character. You know, I mean, it may affect them when they get older, you know, when they're arthritic or something, but you'll have many years, hopefully, of a great pet. You know, who cares if they're missing a limb or an eye or, you know, an ear or something like that? Yeah.
As a younger dog, I mean, it doesn't slow Penny down. She keeps up with the best of them. Like I mentioned that earlier in the show. She's amazing. Yeah. She's probably the quickest dog we have.
Yeah.
She can run. She's amazing. She can dig with that one paw. We call it bionic paw.
Yeah.
And so don't let any kind of we call it affliction. Dogs don't even know it. They don't realize it. To them, it's still a dog, or a cat, or whatever it is, a bird, whatever animal you decide to get. Do not make that a deterrent from you adopting and saving a life, because they will live a good, long, happy life. And again, go to the vet, have it checked regularly, make sure nothing has to be done to it. Penny's leg has been atrophied. No reason to go and amputate her leg. It's not causing any kind of problems or anything. So. If it's not broke, basically, don't fix it. Just leave it alone. And, we want to thank Samantha for saving her life and giving her good quality of life that she still has and going to continue to have. As long as she's with us, she'll be 100%.
And we're going to put our lepto over there in the left shoulder. Influenza. Left hind. That's just my pattern. Not every vet follows the same pattern.
Yeah, it's basically the same routine that we used to use at the shelter also, just so we keep track of exactly what inoculations were, and if there's any kind of reaction, we can always go back.
These guys are pretty well behaved, and they handle a lot of stuff. There you go. Now sneeze it all over Dr. Moore.
Spaying and neutering. How essential is that?
For the girl dogs, it's so important. You know, that they be spayed, because what dogs do is every time they go through a heat cycle, it increases their chances of basically doggy breast cancer. They get cancer of the mammary glands.
Yes, correct.
And it doesn't show up for many years down the road. So if you spay them when they're young, it's almost a 0% chance of that if you spay them before the first heat. It's always best to spay them. I don't care what age they are. It's always best to spay them. Yeah, not that I, you know, am happy about the whole breeding thing, but
of course not.
You know, because there's so many good ones out there already. Exactly. But some people choose to do that, and you know, I always tell them, if you're going to do it, then when you are done breeding, you get that dog spayed. An unneutered male over time the prostate will enlarge, and if it gets big enough, and you can't see it, it's inside.
Right.
If it gets big enough, it'll close off the urethra, and they can't urinate. So what happens is you got, you know, Spike, who's 8-10 years old, and he's marking trees, and you know, he's got those, you know, he's dribbling here and there, and that's normal for him. But how are you going to know what dribbling is normal and what dribbling is abnormal? Because when that prostate gets big and it squishes on that urethra, they're going to start dribbling, and eventually they may not be able to urinate. You know, the guys, you know, they like to, you know, sometimes they'll dig out the yard or not be as obedient.
Correct.
If there's a female in the neighborhood that's in heat and you don't know it, and you're wondering why, you know, Spike's digging out the yard.
Testosterone level is way up, and they're looking to get out to procreate and do what they do.
Absolutely. I mean, there's health benefits to the neutering of males. Like I said, the prostate, testicular cancer is a possibility. And then you've got your behavioral aspects.
Yes,
so
very much so.
Yeah, so you know, it's never too late to spay and neuter anything.
Any animal.
It is.
And for you gentlemen that feel that neutering your male dog is going to affect you in some way, I call it brain surgery. It's not going to affect you in one way or the other. It actually, it's a great thing, believe me. I have a 110-pound American Bulldog. He's been neutered since I have him. I got him from the shelter. I've had him for 3 years now. And believe me, it hasn't slowed him down. He's all male, and I guarantee you it hasn't slowed me down any either. So please, don't let that deter you. That's not going to affect your manhood at all. Do the right thing for your pet, all right? Take yourself out of the picture. Think about them. Don't think about yourself all the time. We want to thank Dr. Moore for giving our two guys here a clean bill of health. We appreciate everything you do for us. He also helps us with our rescue dogs. We bring them here in every emergency. You've seen my guy a few times. TLC is located at 155 Heights Avenue, Inverness, Florida. You look for the ABC liquor store right across, and come down, come see a doc. I want to thank you for everything.
You're
we
welcome.
appreciate
Thank you. It's been a pleasure.
Thank you for all the information.
Sure, I love educating people, and you educate them, and everybody, we appreciate you and all the work you do.
It's a great thing.
See your big dog.
Thank you so much.
You're welcome.
Continue watching. We're always going to have something new to bring you. Remember, spay and neuter.